Hello and welcome to another episode of Capsule RX Podcast. Today, I am one of your hosts. It's been a while since I had a co-host on with me, Dr. Jovin with Dr. Carmen Hernandez. Welcome.
Hi, thank you so much. I'm excited to be here.
All right. And today we're interviewing someone who is not the most traditional type of healthcare professional. Okay. He is the author of the PharmD to MD, owner of the Physician Pharmacist Company, and the creator of the Physician Pharmacist Podcast, Dr. Nathan Gartland. How are you doing today?
I'm doing great. Thanks for having me on the show. I appreciate it.
Yeah, of course. It's a pleasure to have you on. Now, just a little brief background on Nathan. He is actually someone who started off as a pharmacist and now went ahead and get his MD. So this is what today's episode is going to be about. Kind of anybody who's thinking about doing some further education, some further learning, and maybe getting a higher degree, or a different degree within the profession. We figured this would be a great episode to have and a great person to kind of lead us and guide us through their journey on why they decided to do this and how, if you are kind of in those shoes and thinking about it, you can now have kind of a resource to reach out to. So to start off, Nathan, can you please provide a brief introduction, about yourself to our audience today?
Yeah, absolutely. So again, my name is Nathan Gartland, and I went to a 2+4 pharmacy program, down in Pittsburgh. The school is called Duquesne University. So I did 2 years undergrad and then 4 years of pharmacy school. After which then I kind of throughout that process, I made the decision to apply to medical school, and I matriculated right away into medical school. And I'm currently at University at Buffalo, and I'm currently also in my third year of medical school. So it's been a long journey to get to this point, but it's also been very rewarding. So it's been a lot of ups and downs for sure, but I've enjoyed every second.
Great. That's really exciting and also a tough call to make. Right. You're already putting in so much time with pharmacy school, doing the 2-4. So at least you didn't have to go through the whole bachelor's, 4 years of the bachelor's. You did 2 years and then you went into pharmacy school. But can you kind of walk us through that thought process? Like what led you to decide, you know what, I'm going to go back to school and this time go get my physician degree, go be an MD?
Yeah, absolutely. So, I had always thought about medical school in the back of my mind. But I started out with pharmacy because my parents were working in that kind of industry a little bit, and they kind of recommended, oh, this might be something interesting to look into. So that's kind of what initially started my interest in pharmacy. I definitely did well in science, math and science in high school. So, that's kind of the traditional story that everyone says. In pharmacy, there was this nice program at Duquesne. Like I said, that was 2+4, so I didn't have to worry about going to a 4-year degree beforehand. So I kind of rolled into it with that expectation, but I was still keeping everything open when it came to undergrad. And so during my 2-year undergrad, I was still thinking about medical school at the time, but I was thinking to myself, I have all this perfect setup right here. I haven't even tried out pharmacy school. I want to give it a fair shot before I kind of go somewhere else or think about something different, especially when I had it all nicely set up. And so as I progressed through pharmacy school, I really enjoyed the content we were learning, and especially as we got to our clinical portion, which was, I guess, my second year of graduate school. And that's where you start to kind of get into the pathology and, really learn in-depth pharmacology. And I was fascinated with like the diagnostic component to medicine. And so that kind of sparked my initial interest of maybe, I like the pharmacy side and the management of things, but I wasn't totally, I guess, fulfilled with everything that I had been learning at that time, or I guess I was just more curious than anything to kind of explore other avenues. And so, I put a lot of emphasis on the fact that I had a mentor, who was in the pharmacy class above me, as well as a physician mentor who had gone down this path, ahead of me. And they were, really influential with making that decision and providing that information, down this very unique career opportunity that I feel like a lot of pharmacy students don't necessarily have access to or are aware of. I think I would be in a very different position from where I am now if I didn't have those particular mentors in my life. So they kind of introduced the idea. I had this curiosity, and they kind of fanned the flame underneath that and said, hey, take a look at this. Maybe you should think about taking the MCAT. Here are some, how about you just come shadow me for a day and see what, the life of a physician pharmacist is. And so, that really, really drew me in. And after that shadowing experience and after working with that upperclassman student, I was pretty much like full swing, and I kind of followed in their footsteps along those lines. I hadn't totally left pharmacy at that point or anything along those lines, but my focus had shifted. And so I originally been planning on doing a pharmacy residency and getting really involved in the clinical pharmacy realm. So my application was kind of oriented in that direction, but I kind of, pivoted from that highly clinical focus, resume padding, building myself up to be a clinical pharmacist, kind of pivoted away and just kind of changed the focus, like I said. And so by doing so, it really made the transition into medicine pretty easy, which was nice. And I just have to say that my mentors have been, found, I guess, absolutely amazing when it came to, directing where I wanted to be. So, as I progressed to pharmacy school, I kind of followed this, different path, thanks to the early exposure. And that ultimately led to me taking the, MCAT during pharmacy school, which some some students are interested in doing that. I think that's usually the first step, that you should consider if you are considering this down the line. Because you don't want to abandon ship and leave pharmacy when, maybe you don't do well in the MCAT, or maybe it turns out you're not as interested in the profession as you should be. So some of those things, you don't want to put all your eggs in one basket and then it turns out that it was the wrong basket. So, pharmacy was it could be a very, very rewarding career, and it would have been for me. But, I wanted to explore some other opportunities, and it turned out that I ended up in medical school. So I don't have any regrets about that decision.
Yeah. So it sounds like the seeds were planted your second year, where you went through a lot of the clinical information and the pathophysiology and the diagnostic really intrigued you. So going from there, gaining some practical experience, was that also your second year, when you got to shadow your mentors?
Yeah, it was a little bit in the second and third year, but
Okay.
primarily second.
Second. And then at no point in time did you say to yourself, I'm just going to switch now? You wanted to wait a little bit and keep giving pharmacy a shot?
Yeah, I think it can be a little challenging for some students because you're already kind of dedicated to a graduate level program. And so some of the credits, especially at my particular time, wouldn't have transferred anywhere. So if I had decided to switch into a pre-medical program, basically those 2 years of pharmacy school would not have been sufficient to transfer anywhere else to get me like a 4-year degree, because I'd already been in 4 years of college at
Yes.
that point in time. So that was kind of definitely a barrier for switching out. Now, I have talked to students in the past, and it is something you could consider is doing the pharmacy track as well as doing the pre-med track. And most schools will actually be willing to add you on if you just talk to their admissions board and all of that information. You'll obviously be taking an extra half credit or extra credit every semester. So it's a little bit extra work and gives you access to some of the more traditional, medical school applicant, resources, like obviously mentoring. But I think the fact that we have such a unique background and we're coming from such a non-traditional approach that some of the information that they might give you won't even be applicable. So I actually considered applying to the pre-med program, during pharmacy school. I was like, maybe I should do this. And I, sat on there. I was like, oh, I don't know if it's worth extra credit money. And I don't know if I'd really get a whole lot out of it. So that kind of, on top of that, I decided I'll just stick it out in pharmacy. And another factor that actually you have to consider is applying to medical school. You have to do it an entire year ahead of time. So I wasn't really, I guess the way that the trajectory of which my career was going at that point, it wouldn't really make a whole lot of sense to switch out. And then I still would have had to wait a whole another year at that point. So I was close enough to the end of the didactic portion, that I was just convinced I could just finish this out. It's not a big deal.
So still, it wasn't like it was definitive within you to go ahead and explore med school, but it was just something more on the back burners. But it was actually, I don't even want to say on the back burners. It's you knew it was there, but that final decision didn't come in yet. At what point would you say you had that feeling or sensation that was all right, this is exactly what I'm going to go do?
Yeah, that's a great question. I think the nexus of that decision came when I actually went on a medical mission trip down in Haiti. And I was actually down there with one of with my mentor actually at the time, the student, and they were basically that was the original time that I was introduced to them. And I really worked hand in glove with them down there. And there's not a lot of accessible resources. And so as pharmacy students, I was kind of working almost as a medical student at that time. And it was just a really really rewarding process. And it kind of, there was a lot of diagnostic, that went into it and street medicine. So I was just fascinated with the whole thing, that was so just non-traditional when it came to what my pharmacy life was, at least what I looked at for pharmacy. Since I got out of the community pharmacy environment, I got out of the hospital, and I was actually like on the ground doing great things. So it was just a really cool experience. And I think that's when I decided, like, all right, I need to go forward with this. And within a couple months after that, I signed up for the MCAT, and that started the whole, snowball down a hill.
That's a great reason behind it. And I could tell just by like listening to you how passionate of a moment that was for you to kind of help spark you to go ahead and be like, you know what, this is the time, this is the moment that I need to go ahead and start applying everything and making this my new passion. Like, this is the passion that I want to pursue.
No, absolutely. Absolutely. And very interesting when you said that the diagnostic part really kind of like reached out to you like during your second year. And it's funny because during my rotations, one of the common questions I would get from my preceptor is like, how do you diagnose that? Like, what is the gold standard to get diagnosed this disease? Or if it was for an antibiotic, like to streamline it, what tools would you use? And so I would get that question a lot as a pharmacist. I didn't even think about going the physician route, but I can see like how it goes hand in hand together, because even though we're drug experts, but we also need to know, if the tools that we use were the right tools too. Because I've had plenty of patients where they were, for example, prescribed antibiotics for UTI, but there was no urine culture done. And so, you have to know what diagnostic tools you need to be able to streamline medications down. So it really goes hand to hand when you think about it.
Yeah, absolutely. And I think with our pharmacy education, a lot of it focuses on optimizing medications and optimizing care. Physicians would struggle immensely if they didn't have us there backing them up and
Yeah.
optimizing and figuring out the right treatments. And so, on the front end of things, the physician has like a differential diagnosis when it comes to, what are all these clinical signs and what do they mean? What other possibilities could this be? And then what is the first line treatment we can utilize for this? I can't probably, most of my peers might not be able to get past that line, but that's the nice thing about having the pharmacy background is that, I kind of have like this dual, foundational knowledge where I can kind of, go in different directions depending on, just off of the experience that I've gotten over time, so I definitely, I think pharmacy has been very foundational with how, medical school has been for me and how great things have gone.
If you could even add on to that, I was kind of thinking, yes, it would definitely help when it comes to probably knowing the guideline recommended therapy for different disease states, like what's first, second line options and whatnot. But is there another thing about getting the pharmacy degree while being in med school that you probably didn't even realize pharmacy would have helped with this?
Yeah, that's definitely a great question. I think the pharmacy degree goes a long way when it comes to applying to medical school. That's a huge feature, but we can explore that more in a few moments. But one of the things that I really took away from pharmacy school when it came to just being in professional school as a whole is that pharmacy trains you to be, a professional when it comes to working with healthcare professions. You have to be able to work in an interpersonal team and solve problems. And I think that's like that early introduction has been like really important for my experience in medical school. I felt like I've had like a leg up when it came to maybe some of my peers who might not have had such robust experience with working with patients. And so having just the pharmacy background when it came to professionalism, when it came to just even just familiarity with like being in a hospital and understanding the workflow that needs to go on to provide patient care has been really, really important. And it's really helpful. Like I felt so much more comfortable light years ahead when it came to some of these more like practical things that you might not even think about outside of just the clinical knowledge that's added to my experience.
No, it makes perfect sense. Like I'm even thinking, since we mentioned ID earlier, like you understand the process of vancomycin, you can understand why sometimes the trough might be high. Hey, maybe the dose is good, but was it possibly because the admin times are off, or was it drawn too early and different things like that? Whereas maybe the physician isn't as aware of it. They just see it's high. It's like, all right, let's DC, do something else, so it's like certain things could be playing into the role. So mentioning that, I could see how you're more well equipped to lead a team of healthcare individuals because you've gone through this. So I can definitely see how that's played like a benefit to you being a physician. Cause, oftentimes I'm sure you know this, like with rounds, it's like we all look at the physician as a leader, but then now you can kind of test the two of the different roles within the team instead of just one.
Yeah, 100%. And of course, there's other specialties and individuals in medical school and in my class that have, different backgrounds. Some of them are like went to anatomy PhDs and beforehand. So I think just, a lot of people are going to have a lot of different diverse backgrounds when it comes to medical school. But having the pharmacy, I can't stress like how useful it's been, with my experience. So, there are some things, I was hoping there would be a little more exposure to, but it's not always the case. And it's going to be different for everyone, across like where you go to medical school. So, it's been really great to have. And I just wish like I wouldn't be where I am today if I didn't have the mentorship that I did. And so that's my whole like purpose of, being on the shows and doing all this is to kind of introduce the idea to interested pharmacy students. So that's, I guess like I want to emphasize how important the PharmD has been.
Yeah, definitely. And then not only that, the value of great mentorship, because that I would say also kind of impacted me to do a podcast and to do kind of the untraditional things in pharmacy, just because I had a mentor who was untraditional. He's like, you can do whatever. It's just like, just do it. It's like, you're a hard worker. If you're a hard worker, you'll make it work. So just do whatever you want and be happy. Like, you don't have to fit in the box that people try to put you in. Like, you can think outside of the box and do different things. And I think that's the most underrated component of our profession is the mentorship and the value in mentorship that we have. A lot of times we just think, work, or we have preceptors and that's it. But it's like, if you can get you a strong, solid mentor, that can go a long way to helping you develop a growth mindset and really do whatever you want to do with your career.
Yeah, I think that translates to pretty much any profession. But, I think that, like I said, without those experiences and that kind of guidance, I don't know if I ever would have pulled the trigger on it or known about doing that. I feel like pharmacy kind of shifts you, at least from the educational standpoint, always kind of points you either, pick when you're in pharmacy school, pick two paths. You're either going to be a resident or you're going to be a community pharmacist, and don't stray from the path. And I think it's important to ask those questions. Could you be an ambulatory care pharmacist? Could you be maybe a nuclear pharmacist? They always hint at that one as being, I wonder how many jobs are actually out there for that. But, it's just, there's so much more. I think like the PharmD used to be like a destination degree, and I don't think that's the case anymore. You can use it to pivot and launch yourself to all your different career aspirations. There's so much you can do with the degree, just having that doctorate behind your name.
And apart from the experiences, which as you mentioned, having the PharmD degree really, really boosted, having that experience and that clinical background. Would you say that it also facilitated the application process? Because I know you mentioned you took the MCAT. Maybe, some students that are thinking of going through that route, they might be worried about the extra classes needed to take, or that maybe you didn't take to get into pharmacy school. So being in a doctorate program in pharmacy, did that help get into medical school easier?
So definitely a lot of information to unpack there, because we could have a whole podcast in just the medical school admission process alone. But to kind of give like a brief overview, and then I'll circle back to that question. So like I said, you apply to medical school a whole year in advance. And so a lot of preparation goes into that application. And there's 3 different tiers of applications that you can conduct and complete. So obviously you have your MCAT first, which is like your medical school, medical college admission test, which is basically like the big, rubber stamp that goes on your forehead that says like, this is my score. I'm qualified. I did this, that's basically the only standardized test across the country, that allows, interviewers to basically compare, applicants, objectively speaking. And so then you have the primary application, which is a whole laundry list of your personal statement, a whole bunch of other things. And there's work activity section. And I will tie in that the PharmD definitely helps. Like my clinical experience has been, influential in the sense that I've had so many more experiences that I could share and comment on in my primary application that I felt like it, really helped me shine when it came to medical school admissions. Now it's hard to say because I was obviously an applicant at the time, so I can only, tell you how many interviews I got and, what the outcomes were of that. But so it's hard to say how influential it really was. But so obviously I put all of that information and my pharmacy background into the primary application. And then after you submit your primary, then you do a secondary application, and that's individualized to every medical school that you apply to. So if you apply to 20 medical programs, well, then all 20 of them are going to have a different secondary with X amount of prompts that you have to fill out. And these are, sometimes essays, multiple essays that you have to submit to schools. And those are all individualized. Like, why do you want to go to our college? And, tell me something unique about you. So sometimes you might be able to have a little overlap, which is nice, but that's not always the case. Additionally, then after that, then there's supplemental content to kind of make sure that you are like an ethically sound individual. You might be good on paper, but if you don't know how to talk to a patient, that's problematic for sure. And after that, then you get to interviews. And then after interviews, there's a whole bunch of different types of interviews you could come across. It's not just like the standard, I remember in pharmacy school, we had just like a one-on-one interview and that was it. But there's so many different ways. Maybe that's the case now for pharmacy school since I've been so removed, since they had like the admissions process. But they have like multiple mini interviews. They have group interviews now, different things to talk about. On top of that, then after you have your interview, then you wait several months to even longer than that to hear. And sometimes you'll get just one email that says, "Oh, sorry, you didn't fit." And your whole career kind of hangs on that. But alternatively, you might get lucky and you got the acceptance. You impressed someone at that time. So that's kind of like the full cycle of how applying to medical school. So first of all, learning all of that, especially as a pharmacy student, was very challenging. I had my mentors, of course, but I didn't have them sitting there like holding my hand through every step of the way. They said, "Oh, there's this thing called the MCAT. Find out about it," stuff like that. So they're obviously busy themselves too. So, and they were obviously applying to medical school at the time or were a resident, medical resident. So a lot of those things that is part of the reason why I, do these podcasts, create all these resources is because I had such a difficult time figuring out all this information while balancing my pharmacy responsibilities. And that was certainly a challenge, like attending medical school interviews while on my API rotations. That was definitely a conversation to have with some of my preceptors, but it's definitely been influential, like having the pharmacy background to make me stand out, especially on interview day. Just like we're talking right now, it's like some of the interviewers who'd be talking to me I felt like a peer to them. I was just the pharmacist on the ward, and we were talking about medications and psych drugs the entire time. And they didn't even ask me a single question about my application. So it gives you the opportunity to have that good rapport with the physicians versus someone who may be like a traditional applicant. They ask you a question and, the applicant's just traditional. So they're just like, "Oh, I volunteered once in the hospital and it was great. Convinced me I wanted to be a doctor." It's like, okay, sure. But sorry. So I said a lot there, but, I think to kind of summarize your question, the PharmD was definitely very, very, influential when it came to, applying to medical school in the sense that it helped me write a lot about content, have that professionalism like I emphasized previously.
Definitely sounds like it was a great tool in the toolbox to help you sell yourself. Because you have all of those different experiences, like you're saying, that you can attest to in the interview component. And then if there's any clinical questions, like you'll probably also know the exact drugs, maybe even the dosages you might be able to say and attest to, whereas maybe other physicians just know the drug and like pharmacy will figure it out. Pharmacy will figure out the right dose and the renal dose adjustment and all that. But whereas you probably already
absolutely.
Yeah. Yeah. So, got it. Perfect. And then I kind of want to ask you, when it comes to the PharmD degree, we know how it will help benefit you, but how do you plan on that PharmD and MD degree really playing a role in your career?
Yeah, that's a great question. I think, just the first component of that is our shared experience working with the pharmacy profession. Obviously, like I have strong roots in pharmacy, and so I never want to leave those roots. I don't want to, abandon the profession or leave, entirely. So staying connected, I think, is really important. And I want to continue that connection throughout medical school, obviously, and then throughout my time practicing. So, I'm obviously going to be biased towards, when we're rounding on the floors, I'm going to have I give a lot of respect to my pharmacy team, but also just really helping integrate and break down some of those barriers just with my peers, with the pharmacy profession. I know like there's a big complaint, in just current practice that there's, some barriers between the profession of pharmacy and physicians and not necessarily respecting, some of the hard work or the recommendations that we put in. Now sometimes that might be, warranted, or we might not know of a particular disease or illness that has like this very niche specific, management criteria. But alternatively speaking, I think more often than not, it's, just it's kind of like an ego thing or something along those lines.
Yeah.
And I've never worked with any physicians who are like that. So, full disclosure, but, it's something, that I think that the profession as a whole has major complaints about. So kind of serving as that bridge between the two professions and really advocating for pharmacy because, pharmacy school is hard. It's not fun. And so anyone who gets through that is, I have a lot of respect for.
Which school would you say is harder right now? Med school or pharmacy school?
Oof. All right. So I kind of had like a flip flop on this answer. So I think the first 2 years of medical school, so medical school is broken down into like 2 years of didactic and then 2 years of clinicals, versus pharmacy, which is 3 years didactic, 1 year of clinical. So my didactic portion in comparison to pharmacy's didactic has been pretty similar, I would say, when it came to like academic rigor. There's a little bit more volume in medical school, but it wasn't like anything where I was like, oh my gosh, I can't handle this. Anatomy's tough, I think, just because we as pharmacists never got exposed. Maybe some programs do have like a small crash course on anatomy, but for my particular program in pharmacy, we had no anatomy exposure. So I went totally blind. So that was definitely a challenge. It was more just, totally novel information versus, obviously like medical management. I was very good with that when we got to like the pathology based lectures in medical school. So kind of to answer that, didactic, very similar between pharmacy and medicine. So if you can make it through that portion of pharmacy, I'm pretty confident that you could, if you did well in those fields, you would obviously do really well in medical school too. When it came to rotations, it's not that anyone wouldn't do well. It's just the hours are a lot more time consuming, to say the least, without stepping on too many traps here. But yeah, as you can imagine, the hours are very long and you have a lot of, responsibilities. Like I take call. That's like a thing that a lot of things I felt like I didn't have to deal with on pharmacy rotations. So, I think that comes with the territory too. It's kind of prepping you for residency. And so it's kind of an expectation that, you're putting in all that work. So I think rotations as a whole, not necessarily that it's been more difficult, but I think the hours have been a lot more strenuous. I feel like I definitely have less time for extracurriculars and other things. But I think that'll change because when I hit 4th year rotations, that's when all my applications are kind of in and things supposedly get a lot lighter. So maybe I'll have a different opinion in a couple months.
Okay. So from what I got seems
yes,
like med school is a little bit tougher. Med school is a little bit tougher. That was a professional way of saying med school is slightly tougher. So great job. Those were my words, not Nathan's. Anybody has a problem, talk to Jovin. All right. No, I've always wondered. I don't remember who, but I think somebody told me that they thought pharmacy was harder, but I think for them it was because they were less passionate about pharmacy. It wasn't like it was tougher. They were just more passionate about med school. So it was just easier for them because they actually wanted to learn all that stuff.
Certainly. I think that like motivation is obviously a huge component. And I will kind of, amend my statement in the sense that pharmacy really, really focuses heavily on like mechanisms and pathways and things. So like I feel like they do a deeper dive into content. So if you're not really feeling that approach to education, that can certainly be a lot more challenging. Medicine's more of like a broad net and we don't go as deep with a lot of the content. So it might just depend on your learning style too. I'm one individual. Some people would, argue that pharmacy is certainly harder. So you'll have to listen to some of my peers who have made the switch, see what they think.
Yeah, definitely. And then, I wanted to ask another question. So you didn't tell us exactly what you wanted to do. Do you know what you want to do with your career?
Yeah. So I've kind of
or at least what you're thinking now.
And also, what year are you in too?
3rd year. He said
you're in your 3rd year. Oh, never mind.
Yeah. I'm in my 3rd year. 3rd year, the saying 3rd year is the worst year of medical school. Just because you're really busy with clinical rotations, you have to hit all these requirements on top of preparing for residency applications. And
right.
So there's a lot that goes into it. I'm still obviously learning about that process thus far, so I probably can't comment too much on what goes into it and all of that. But it's a very, very busy time because we, unlike pharmacy, we actually take our boards throughout medical school, and there's 3 different levels.
Wow.
Versus pharmacy, you kind of take your NAPLAX and your MPJE at the end. Alternatively, we take them in the middle of medical school and then also post like middle of residency too. So it's kind of a weird layout. But what I want to go into is I'm thinking heavily anesthesia at the moment. I was originally playing around with emergency medicine, but and I still haven't had a couple rotations thus far, so I can't, say I've crossed those
For
out
sure.
entirely, but I'm thinking probably 95% I want to do anesthesia. I really like the hands-on component to it, as well as you have to be really good with like physiology. And obviously having the pharmacy background, you have to be aware of like, the way medications actually work and affect like the volume of distribution. So almost more like
Absolutely.
pharmacokinetics and dynamics.
Okay, so an anesthesiologist is kind of where you're leaning towards.
Absolutely.
All right, that's awesome. And then, yeah, that definitely the PharmD degree will help. I mean, you just explain how, but that's what I was wondering. I was like, I wonder what kind of job you're, if it was ID, if it was maybe cardiovascular, different things like that. But definitely I can see it playing a big role with being an anesthesiologist.
Yeah, my mentor is actually an infectious disease attending, so he's like the one who started all of this, but yeah, he uses his pharmacy background like extensively. That's probably one of the best fits, I would say.
Yeah,
Obviously
that's what I would
internal
think.
medicine is also a really good field, just because there's a lot of medicine, a lot of medications that you're titrating. Surgery, probably is less of a good utilization, depending on what you go into. One of my other mentors that I've worked with, he's a cardiothoracic surgeon. PharmD cardio. And he actually has a strong position on the fact that there is a lot of pharmacy in surgery. So it's a very interesting take that I came across. So I think it just depends on who you talk to and how you kind of implement pharmacy in that particular field to find the right fit.
Yeah, definitely. Like with cabbages, it's a lot of different cardiac meds that kind of come into play, and they might also have some heart failure, some blockages and whatnot. So yeah, I could definitely see how that could play a role too, helping determine like what type of therapy you would want to use. So it all kind of makes sense at the end of the day.
Yeah.
I'm not going to do it, but, but it all makes
why
sense.
not?
Like, yeah, it's a great idea. For those of you that want to, it's a great idea. For me, not so much, but, no, that's awesome. Something else I was wondering was, how do you have time for all this? Because we're about to get into your book, and you have the podcast, and you're in your third year. How do you have time for us?
And then you have to study for the boards.
Yeah.
So.
Well, give us the secret to your time management skills, please.
There's I guess basically just no sleep. But no, another thing I got out of pharmacy school, I do really think I learned a lot, obviously, in pharmacy school. Like no kidding, but just the time management was really, really important. And so I have a big emphasis on time management. I really also compartmentalize what I'm doing. So if I'm focused on studying, I feel like a lot of people these days will sit down, they'll say, I'm going to study a lot today. And then they'll pull out their phone every 5 minutes and then they'll get distracted, or there's a TV on in the background, or, a lot of distractions are obviously very time consuming and kind of disrupt that mental focus. And so I really focus on, staying in that box and just finishing the task at hand. And that opens up a whole avenue of opportunities where like I know if I stay dedicated and get this work done, I'm going to totally enjoy playing Xbox later, not that I get to do that very often, but, cause obviously I have extracurriculars and research and studying for boards, but I also have this hobby where, I'm working on my own business and trying to kind of build the platform for individuals who are interested in this career. So, I guess time management, it's kind of a, cliche answer when it comes to answering your question. But I think that individuals who are very disciplined will find that there's actually quite a bit of time throughout medical school to really get what you want done. Like I've worked as a pharmacist for, the last 3 years of medical school and
Wow.
about 18 hours a week for the first 2 years of, during the didactic portion. Third year, there's absolutely no time for it. When you're doing 80-hour weeks, it's not possible to continue on and have like a life. But I do plan on doing some more of that, later on in fourth year as well.
Hold on. I didn't think about this.
What?
So once you get your MD license, are you still able to practice as a pharmacist if that license is active?
So now we're getting into some gray territory, and I'd probably have to talk to a legal expert.
Yeah.
But I guess from my understanding, I feel like it might be a conflict of interest.
Yeah.
Now you can practice independently, but I don't think you'd be able to write your own prescription, then go
Yeah,
fill
exactly.
it, you know?
Yeah.
That's a slippery slope right there. But technically speaking, you could, keep your license active, and then, if you wanted to work a side gig or something like that, you could theoretically, maybe during residency or something along those lines.
Oh, wow. I never thought about
That
that.
is
Like
so
having both
crazy.
degrees and actually using them.
Yeah.
That's cool. Oh, maybe I will rethink this whole MD
That
thing.
is so crazy.
Oh, that's cool.
Yeah,
okay.
it's been a nice way to supplement some
That's
income. I
awesome.
also kind of keep my
Yeah.
feet wet with pharmacy, so it's
You don't lose
I
it.
do enjoy it. Sometimes it can be a little stressful, but
Mhm.
managing a work schedule on top of just coordinating like, oh, I can do a 4-hour shift on Thursday night 3 months from now. It's like, and then
That is
some
so
meeting comes up, you're like, uh-oh.
You
So
get the best of both worlds.
exactly.
That'd be awesome.
Yeah. Yeah. And then just to tie back what you were saying with time management, I think you touched upon something that was very key, is that it's a lot of being well grounded into the activity that you're doing. So if you're set the time to study, your focus needs to be on studying. It shouldn't be on your phone. You shouldn't allow distractions. Throw your phone. I just throw my phone somewhere. I don't know where I put it. That's what I do. But you could put it on silent, whatever you have to do. I know
Do not disturb.
do not disturb. That's what I was saying.
Mhm.
Yeah, thank you. Like all these different things that you can do to help block out the noise to help you focus. So it's like, that's one of the things I would also recommend too, because I know a lot of times, most of our listeners are students and always ask like, how do we make time? How do we blah, blah, blah. It's all going to come from you being disciplined and understanding that when you set an objective for you to accomplish, you have to just lock in on that accomplishment. And once that's done, you can address the other things that are going on. So always try to be as well grounded as you can be in the activity that you need to focus on. If it's time for you to, have fun, then just focus on fun. Don't be focused on work and other things like that. Like set your time for certain activities. And when you're doing those activities, just be 100% locked in. And then you'll have plenty of time to do whatever you want to do all day.
Yeah, there's so many stimuli these days where everyone's kind of grabbing for your attention, and just having that focus, like you said, is going to be crucial and you'll be surprised that the results actually demonstrate that, hey, I'm starting to do better on my exams. I'm starting to be happier. I'm not stressed about, I'm out having a good time, and I'm not stressed about the thing that I was supposed to do today because, I wasn't diligent with my studies. So it goes a long way. And that simple little tweak in your life can make a whole lot of difference.
Watch out, Dr. Oz. Dr. Garland's about to take your shoes. This is awesome. So we got a deep dive into pharmacy school. We got a deep dive into a little bit about the med school application process, a little bit about what you're planning on doing with your career, some time management tips. That wasn't even on the list, so you guys are welcome. But next, I kind of want to talk about the book. So you are the author of PharmD to MD. I believe the title's kind of self-explanatory, but can you kind of just talk to us about the book and what kind of inspired you to write this, and what are some of the takeaways you want our audience to have regarding this book?
Yeah, absolutely. So kind of to preface, why I even started in the first place. And so obviously I applied to medical school, and I remember writing down a lot of information. I like to keep track of things because you never know when it could be useful. Documentation and data is huge. And so, I basically sat down after I'd gotten into medical school and I was like, why was this process so challenging? Why was it so hard? And, why did I have such a miserable time? Why did I spend way more than the average applicant does? Partly because I didn't have any mentorship. And I was like, well, how can I make this a resource basically for students who are considering going down the path? Like I had people, after I'd gotten into med school from pharmacy school in the classes below who were asking me tons of questions, and it became kind of tedious. I was like, oh man, I got to answer this email and this email and that email. So I was like, what if I just made a comprehensive guide that kind of facilitated and answered all of those questions and things that you can't find anywhere online? You can type in, PharmD to MD, but you'll get one or two, options, and there's hardly anything comprehensive, I should say. And so pretty much I decided like, hey, I have this template right here of all the things I hate about the application. Why don't I just kind of formalize that, but also add more informational content that students can basically follow step by step. They can jump in at any particular time, depending on what year in school you are. You could be a PY1, first year professional, and I have a template that shows you exactly what you should be doing each year of that particular, stage if you are considering your ultimate goal at the end of the day is to go to medical school. So, get involved with research, start, setting up different, things along those lines and getting shadowing opportunities. So kind of, and then obviously sharing my own like experiences, like, hey, by the way, don't apply to every medical school that you think you can get into based off of just your MCAT. That ended up costing me a couple, $500 here and there, on just wasted application fees, which is pretty substantial for a pharmacy student who's already got a ton of debt. And so that's part of the, I guess, rationale for writing the book. And so it took me a full year. I started med school and I had this, PDF 4-page document of just, my notes and comments. And I was fortunate enough to have one summer off. Like that's the only summer you get off throughout medical school is after your first year. And I was like, wow, like I should be doing research, but instead maybe I'll just like sit outside and just, type away at this and see if I can create something. And so I did so, and obviously I made the book, and that kind of, I never would have expected that I guess my company has like, expanded to what it is now, where I have an online website, I have a podcast, I just created a video course that kind of streamlines the whole book basically down into 10 hours worth of lectures. So that's obviously another resource that students, because I know it's busy, like who has time to sit down and read a book? Not everyone has that diligence. So that's part of the rationale, I guess, for doing it. And I love working with students, giving back. I do a ton of like consultations with students where I just like meet up with them, say like, hey, so you're thinking about going to med school? They're all the way across the country. But, I think it's fun. It's important to give back because I obviously was so passionate about this career path, but I was also influenced by a lot of my mentors. And so I want to make sure that I, provide that for students who are also going through this, I guess, like this challenging period in their life.
Yeah, no, definitely. And it makes sense. And even with us, some of the things that we do, it really came from a place of feeling like we had no help, completely lost. And it's like, all right, how can we give back and help other people? And so some of the services that we have, that's kind of how that came about. It sounds like you have the similar story. It's just, hey, like it was challenging for me. I already took all these notes. I already did all these things. I might as well give it to y'all. So anybody that's interested in making the switch, it could be at least 100 times easier for you guys because I already went through everything. So you didn't have to. So now you can kind of follow these guidelines, these stepwise process, and your life it'll be way easier for you to get to your ultimate goal.
Yeah, and I think there's going to be a growing field. Like I said, the PharmD is no longer like a destination point where a lot of people are using it to kind of jump to other non-traditional careers. And there's also programs like popping up. I know Rutgers is one of them. That does like a dual PharmD to MD pathway, just integrated into their system, which is pretty interesting. I'm not sure if you've ever come across it, but it's like the first of its kind actually. And so people will go to pharmacy school first, then apply for the medical school process, but internally speaking, so they don't have to do the whole outside stuff. And then they go right into medical school. So kind of that program has already taken hold at some of these major universities, and I think it's going to grow. So it's very interesting, exciting time for pharmacy.
Yeah, definitely. And then as far as your book, where can people purchase it if anybody listening wants to get their hands on a copy?
Yeah, for sure. Well, you can reach out to my website, which is physicianpharmacist.com. You can also find the book on Amazon. You can find the course. I just started a YouTube channel as well as under just the Physician Pharmacist or PharmD to MD. You just type all those key tags into YouTube and find some of those resources. But most of my content's on my website and then on Amazon. But I think, obviously a little biased, but, a few dollars here might go a long way with saving you plenty of time down the line. But don't worry, I'm not going to retire off of this, but it's more so just fun to do. I make more working an hour at my pharmacy than I do off this book a month. So
yeah. And it's kind of like same thing with us, like the podcasts, our services that we do. It's just like, it's a fun thing and it's a way to give back. It's a way to help somebody accomplish like their dream goal. If it's to get to a certain residency or get their dream job, like, help them with the interview process and whatnot. So it's like really just giving back and learn from the mistakes that we've made. So that way the process for you is a lot better and you get to accomplish your ultimate goal. So that's all we want is just to help and give back.
Absolutely.
So great. So anybody listening, if you want to get a copy of the book, it's at physicianpharmacist.com. Or you can go to Amazon. It's also there, by Dr. Nathan Gartland. And then the podcast. So is the podcast also related to the book and whatnot as far as like the type of people that you interview and the content that you release?
Yeah, so the podcast is obviously something newer that we've added to the platform. You can find it obviously on the website or on Spotify or Apple Podcasts, anywhere basically. But how it works is basically we interview other PharmD to MDs and other people, and they don't necessarily have to be that, but just people interested in medical school as a whole. And we're also transitioning to more of a just non-traditional pathway. So I've interviewed individuals who've gone to pharmacy school and then went to law school afterwards. And now they're in charge of one of the biggest, construction industry, as law programs in the country, which is pretty cool. So you can and they talk about how they utilize their pharmacy background as basically a major pivot point to kind of bolster their career. So just basically non-traditional approaches we talk about fellowships, residencies, and a whole bunch of other stuff. But a lot of physicians who've gone down the entrepreneurial path too. So a lot of good content on there if you guys are curious. Obviously, plenty of good content here too.
Thank you. And no, I'm glad you mentioned the entrepreneur word, because I was going to say that. It sounds like it's really for anybody who is interested in being an entrepreneur within pharmacy, that this is something that you can kind of listen to and gain some insight on maybe how to switch to a different career, or how you could use your pharmacy degree and maybe start a side hustle or different things like that. Like, you're kind of gaining that type of knowledge and tips to help boost your entrepreneurship.
Yeah, absolutely. Entrepreneurial components. We have a podcast working with Tim Albrecht, going over like finances of applying to medical school with your financial pharmacist. So there's a lot of, little tidbits in there that can help you, along your journey, and you can obviously individualize it to what's going to fit your interests and needs.
Well, this, for everybody listening, there are quite a valuable resources out there. You got the book, the YouTube channels, the podcast, and it can be found everywhere. So really, I would really highly encourage everybody to look into it. Cause nowadays it's so hard, when you really want something, it's hard to find, somebody you can trust, with the information you need and the guidance. So, yeah.
I was going to say not to cut you off, but I did cut you off. That's why I don't have co-hosts, because I cut people off. And not only that, but also I'm one of those people where it's like, how long ago was that book written? Like, times have changed. So this is something that's recent, that's new, that's out there. So it more relates to what's going on in today's time. And I think that's also very valuable, because some of the information that somebody might tell you that happened 10 years ago is not the same with the application process. Trust me. So definitely keep that in mind when it comes to your resources. Like, how long ago was this made? Was this produced? How long did they update it? So you have something that's fresh, that's new, and could be really valuable to anybody that's listening that's interested in going the MD route.
I'm glad you cut me off, because that is a perfect ending to what I was trying to say. So
yep,
absolutely. Go ahead.
No, please.
I was going to say too, I think just a lot of pharmacists in general, this is a point of curiosity. So obviously if you don't want to buy the book, I'm not going to be offended at all, but, on the website, I have blog posts and things along those lines that you can just like read about what is it like to going to medical school? What are the things that I should be aware of ahead of time? That's obviously totally free. And obviously you can find me on YouTube too with the extra stuff, but, yeah, so I appreciate all the book plugs though.
Yeah, of course. And then, for our last question, what advice do you have for any pharmacists or pharmacy students listening that are thinking about making a transition?
Yeah, so it kind of summarizes everything we've talked about, but I think you really have to sit down and think to yourself, where do you want to be in the next 10 years? I think that really put, a good perspective in my head of, I didn't want to necessarily, I was interested in clinical pharmacy, but wasn't sure if I wanted to go through a 2-year residency program. I wasn't sure if it was going to be hands-on enough for me. It didn't have that diagnostic component. So if those are like things that you are actually interested in or, want to explore more, then you really got to be honest with yourself and say, is pharmacy the right career path for me? And I've interviewed people who certainly said this is the best career I've ever been in. Like I could never even consider. I thought about it for a few moments and I was like, no, that's not where I want to be. I think there's a lot of, downsides of obviously going into medicine too. So you have to be aware of those. So, we talked about all the great things that, we could do in this podcast today, but You have to think about there's a work-life balance trade-off. There's certainly, obviously delayed gratification, an additional X amount of years plus your residency. So those are things you have to think about. And definitely the financial consideration is also important. If you have tons of pharmacy school loans like myself, that's something I really had to think about and sit down and say, like, I'm going to go into way more debt,
Yeah.
On top, I'm basically just going to multiply my current debt, which is like $160,000. So no silver spoon here.
Yeah.
And multiply it by 2. And I go to a cheap medical school too. So, there are some medical schools that are $100,000 a year, which is pretty crazy. Definitely, sit down, have that kind of moment. I want to be in 10 years. Do I want to learn balance that I have? Once you kind of come to that consensus, the money thing is obviously something you should consider. You have to do your due diligence. But at the same time, I wouldn't let finances be a barrier, just because down the line, things will work itself out. You'll have opportunities to kind of make all that back over as you work as a physician. So it can seem scary up front. It certainly still scares me quite a bit every time I log into my loan account. But, those are things that you will tackle eventually. So I don't want you to talk to my friend, Tim Ulbrich. He'll help you out.
Yeah, I was gonna say, I'm sure Tim probably has some strategies. And if they don't, I have some strategies. But it's unfortunate. I meant to ask this. Would you say that was probably your biggest challenge or biggest fear from making you pursue, the MD route, was like finances?
I wouldn't say finances wasn't as, I guess, it seems like fake money to me at this point, which is kind of a, irresponsible thing to say. But, they just kind of give you the loan without even thinking about it. So, as a student, I'm just like, oh, more loan money, no big deal. I know eventually, I'm going to have to pay all that back. And I know that I'm spending whatever I buy is going to cost me $2 later. So, that was definitely something. I try to be frugal. I obviously work as a pharmacist intermittently, so that kind of helps keep my expenses low. There's some ways too that I've come across that you can obviously avoid some of those costly mistakes. Obviously applying to medical school is a very expensive process. There are ways that you can minimize those costs. There are ways that you can minimize your costs at medical school. Obviously, if you go to an expensive school, that you're kind of stuck, but you can apply for scholarships and things along those lines. So I don't think finances was the primary, I guess, like barrier. I think it was more so just like the knowledge gaps that I had. I made a lot of mistakes when I was applying to med school. I applied to a lot of programs and I didn't get a lot of traction with some of them because I didn't think about some of the logistics of actually applying to those. Some programs required an osteopathic, letter of recommendation. I never had one of those, so that was a waste of money. So things along those lines. And just the mistakes I made along the way, I think, were probably the biggest barrier, just the lack of knowledge. And all that time I sat in the library studying for the MCAT, and I ended up having to take the MCAT twice because I didn't take it seriously the first time. I think that was pretty much the hardest part. The MCAT is definitely the worst part out of all of this information that I'm sharing with you today. Once you get over that initial hump, it kind of everything snowballs and it gets easier and easier.
All right. Well, thank you. That was it for did you have any other questions, Carmen?
No.
Okay, perfect. So that was it for the questions that we had for you. Before we let you go, did you have any questions for us?
No, I think we're pretty good. I appreciate you having me on the show today. I think we covered a lot of great content, and this is just a super awesome interview, and I appreciate your time.
Yes, thank you. Thank you so much for allowing us to reach out to you and for your time as well and your willingness to be our guest speaker in our podcast. So this was really, really a great interview.
Yeah, great episode for sure. Yeah, I think they're going to love it. And I know a couple of people, I'm not going to say names, but I know a couple of people that have thought about doing exactly what you did, and they didn't do it in pharmacy school. So I can't wait to share this with them to see maybe they'll dive deeper into your content and see if they'll maybe make that switch from being a pharmacist to a physician. Yeah, you don't have to be a pharmacy student to make the switch. I've worked with individuals who've been well into their career who've considered doing it. There are some pros and cons. I think the financial perspective becomes more important as you get further along those lines, just because, individuals with, 10 years out of pharmacy school probably have a mortgage and other things that you have to consider with families to care for, and that can be pretty challenging. Not to say that it's not, being done. I have individuals in my class who are, parents and stuff. So there's
there's little organizations to help out with that too.
Perfect.
Awesome. Well, thank you so much, Dr. Nathan Gartland, author of PharmD to MD, owner of the Physician Pharmacist Company, and creator of the Physician Pharmacist Podcast. It has been a pleasure to have you on. We appreciate it. Thank you so much, and thank you for this awesome content that I'm positive some of our listeners will be moved by, and will definitely take to heart, and hopefully that can help them, whether if it's pivot into a physician career or even a different career. Maybe this can kind of help spark them into pursuing what they're truly passionate about. So thank you.
All right. Thank you.